Greetings again. This is Dr. Bill White with the American Orthodontic Society, and I'm running through some kind of odd cases that we've done over the years, and this one certainly is that way. Now, I did not see this patient until they came in and their upper cuspids had been removed, but I'm sure they came in just pushing their lips out like this, and somebody took them out, and they didn't pay any attention to the lower ones, and the lower ones were out of the bone structure, and so we were bringing them back, but we sacrificed the bicuspids on the bottom, the first bis, to do this. This young man, this was back in when I first started in orthodontics, and I was taking everything that came along, and this really looked bad. I mean, his lower cuspids are exposed like mad, and the upper cuspids are gone. Somebody just took them out, and that left a big space here. This cuspid came out of there and out of this area right here. Now we're going to sacrifice the bicuspid. Let's see, it's somewhere behind here. And then we're going to move these roots back into the bone structure. Just show you can do things, the odd things, and just the best way you can figure out is how would you like to have your own teeth done, and you do somebody else like that, and you won't make too many mistakes if you do that. So anyway, let's go through this, just looking at it from another angle. So his cuspids are gone up above, so we'll have to use a bicuspid as a cuspid, and we can do that and bring this up and close it together. The lateral looks like they're missing a central there. I'll have to see how it comes out here just in a minute. Okay, the same thing over on the other side. So we do have a cuspid missing here, and we've got a central actually missing right there. So that's going to make things a little hard to balance out in here. Now on the bottom arch, we've got these cuspids that are sticking out. We're going to keep them. They're much better tooth than the first bicuspid. So we come back and take the bicuspid out, and we're going to slide this cuspid back in here and then tuck the roots back into the bone structure underneath there. And this is somebody who's not brushing all that super well, but the teeth aren't that bad at all. Okay, here we go. We have taken the bicuspid out, and we're hooked onto the cuspid right here, and we'll put torque in this arch wire and bring this root into the bone structure. We've already brought it in quite a bit. Now, somewhere in here, we've come up with a central tooth right there. Let's see if we can figure out where it came from. It's probably a false tooth, but brought the cuspids in and tucked them into the bone structure, and you can torque them and bring them in, but you can't make the tissue grow back into the root very good. Now, some of the periodontists claim they are able to do that, but that's kind of shaky. Now, that root needs to go in. When it goes in, this crown will come out like that. I don't think we actually finished this case. I don't have the finished stuff on it doing all this, but there this is. Now this is a false tooth we just took a plastic tooth and ground it off and put a bracket on it, put it up, and kind of torqued it, and the tissue goes right into it. And these cuspids are missing here, and this central is missing. Now you can finish this out, and you will put this tooth into a retainer to hold this gap open, and now the young man can get a Maryland bridge that bonds one onto there, or he could go in. Of course, nowadays he'd get an implant and put it in that area right there, but he's missing that particular structure. Now, this on the bottom, we've got the cuspids in here, but we don't have this space closed up good enough. Right here, the 4 anteriors, and then we put the cuspids, and we look like we've got pretty good torque on the cuspids now, so their root should be pretty well back in the bone. And we've closed the space up, and we've brought the roots in. This one is not torqued back in there good enough right there, and these are going to be problems. He can have a gingival graft put over these later if he needs to. And this artificial tooth is just cut off. You can put torque on it, and it'll bury the end of this, and you won't even be able to tell the difference. But we'll put this one in a retainer for him until he can come in and get it. Go somewhere and get the implant. I never did it. So anyway, that's, and here the young fella is, and that's it. And so we're going to say goodbye. Thanks for watching this, but this is a solution to a problem where someone, I don't know who took the central out, but he had the central removed and the upper cuspids removed when he came in to the office. So this is our finish up, just work that we did. We should have, we'll continue to bring those roots in a little bit more. So thanks for watching, and I'm going to say goodbye and hope you'll subscribe to our channel, and we appreciate having you, and I want to say goodbye, and we'll just close out.